Good morning. Tell me what symptoms you've been experiencing.
Good morning, doctor. I've been feeling really unwell lately and wanted to get checked out. Well, I've been feeling extremely tired all the time, and I've gained weight even though I haven't changed my diet. My skin feels dry, and I get cold very easily.
Based on your symptoms, one possible condition is hypothyroidism, also known as an underactive thyroid. This happens when your thyroid gland doesn't produce enough thyroid hormones.
Oh, what causes that?
One of the most common causes is an autoimmune disease called Hashimoto's thyroiditis, where your immune system attacks your thyroid. Other causes include iodine deficiency or past thyroid surgery or radiation treatment.
That sounds serious. How is it treated?
The good news is that it's manageable. The primary treatment is thyroid hormone replacement medication, usually levothyroxine, which helps regulate your hormone levels.
That's a relief. But, doctor, my friend has almost the opposite problem. He keeps losing weight even though he eats normally. He also has a fast heart rate and feels anxious a lot.
That sounds like hyperthyroidism, which is when the thyroid gland becomes overactive and produces too much hormone. The most common cause is Graves' disease, an autoimmune disorder. Other causes include thyroid nodules or excessive iodine intake.
What are the treatment options for hyperthyroidism?
It can be treated with antithyroid medications, radioactive iodine therapy to shrink the thyroid, or in some cases, surgery to remove part or all of the gland.
That makes sense. Now, doctor, my younger cousin is much shorter than other kids his age. His parents are worried. Could it be a medical issue?
It could be a case of dwarfism, which is caused by genetic factors, hormonal imbalances, or skeletal conditions. It results in short stature and sometimes skeletal problems.
Is there anything that can be done?
Yes, treatment depends on the cause. Growth hormone therapy can help in some cases, and in certain situations, surgery or physical therapy may be recommended.
That's good to know. Speaking of height, I once read about people who grow abnormally tall. What causes that?
That condition is called gigantism. It happens when the body produces too much growth hormone, usually due to a tumor in the pituitary gland.
What are the symptoms?
Extreme height, large hands and feet, and enlarged facial features. If left untreated, it can lead to complications.
How is it treated?
Treatment usually involves surgery to remove the tumor, medications to control hormone levels, or radiation therapy if surgery isn't enough.
Doctor, I've also been feeling very weak lately. I lost weight without trying, and my skin looks darker than usual. I also have stomach pain.
Those symptoms could be related to Addison's disease, which happens when your adrenal glands don't produce enough cortisol and aldosterone.
What do these hormones do?
Cortisol helps regulate blood sugar and energy levels, while aldosterone controls sodium and water balance. Without enough of these hormones, blood sugar and sodium levels drop, causing fatigue, weakness, weight loss, and even a bronze skin tone.
That sounds serious. Is it treatable?
Yes, with medication that replaces the missing hormones. If treated properly, people with Addison's disease can lead normal lives.
Thank you, doctor. This was really helpful. I'll do any necessary tests to check my condition.
That's a great decision. We'll run some tests to confirm a diagnosis and start treatment if needed. Also, it's important to note that all these conditions, hypothyroidism, hyperthyroidism, gigantism, dwarfism, and Addison's disease, are disorders of the endocrine system. They occur when the glands in your body produce too much or too little of certain hormones, affecting various functions like growth, metabolism, and energy levels.
That makes sense. I never realized how important the endocrine system is. Thanks again, doctor.